Let's be honest, for most of us, the dentist is someone we think about only when something hurts. It's a place for repairs, right? A place you go when something's already broken. But what if that entire way of thinking is just wrong? What if our dental care could be built not just on drills and fillings, but on a real foundation of partnership and trust?
Welcome to The Explainer. Today, we're diving into a whole new philosophy that's trying to shift dental care away from just treatment and towards real trust. So here's our game plan. We'll look at the quiet crisis facing dentistry, rethink what a dental team even is, discover the power of a true partnership, and finally, see how all of this changes your role in your own health.
All right, so to really get why we need a new approach, we have to look at the problem. The traditional way of doing dentistry, the one we all pretty much grew up with, is facing what you might call a quiet crisis. It turns out that a dentist just having good hands isn't cutting it anymore. For decades, the recipe was simple, right? Be a great technician, be pain-free, and word of mouth would do the rest. Your reputation was golden. But that old model, it's just not working like it used to. Today, technical skill is the bare minimum, and even the best dentists are seeing that it's not enough to fight against this growing sense of patient apathy and just fewer people showing up. And this new reality, it demands a huge shift in thinking. The author of our source material, Dr. Kenji Wakabayashi, says it perfectly. He states, "I declare without hesitation that dentistry is a service industry." Now, that might sound simple, but it changes everything. It means it's not just about fixing a tooth anymore. It's about the entire experience. So if dentistry is a service, what does that actually look like when you walk in the door? Well, it starts by basically tearing up the old org chart. Instead of a rigid pyramid with a boss on top, this new model is all about partnership. The old way was a classic top-down pyramid. The head dentist was up here, giving orders down the chain. But this new model, it flips that completely on its head. It's horizontal. Everyone, from the dentist to the hygienist to the person at the front desk, is working together as equals. And the goal? To make sure every single part of your visit is built on the same idea of collaborative care. So, who's on this modern dental team? You've got the usual suspects, the dentist, the hygienist, assistants, reception staff, but there's one more crucial member. And honestly, this might be the most important one of all. You, the patient. In this model, you're not just some passive person receiving care. You are an active, vital part of the team. And why is that? Because you hold the most important information. Think about it. Your daily habits, your health history, the little symptoms you notice. That's the critical intelligence the entire team needs to build a plan that actually works. You're not just a body in a chair. You're a strategic partner. Now, for this partnership to really click, the whole professional team has to be perfectly in sync across the entire journey of your care. And that journey is broken down into 4 key phases, from initial treatment all the way to long-term maintenance. That first phase, by the way, is absolutely critical. It's where about 80% of the groundwork for success is laid, so that teamwork has to be seamless from day one. This idea of a collaborative team isn't just some new business strategy. It's actually rooted in a really deep philosophy of partnership. And this philosophy is captured so beautifully by 2 Japanese concepts that totally redefine the relationship between a patient and their healthcare provider. The first concept is called Sotaku Doji. It's a Zen term that gives us this incredible image. Picture a baby chick, ready to hatch. It starts pecking at its shell from the inside. At that very same moment, the mother hen starts pecking from the outside. If their timing is absolutely perfect, the chick breaks free and lives. That right there, that's the ideal partnership. Success only happens when the effort is perfectly synchronized. And that perfect partnership, that synchronized effort, it's all designed to awaken the second key concept, Henkan Ryoku. Now, this is a term Dr. Wakabayashi actually created, and it means the patient's power to change. It's this core belief that every single patient has the built-in motivation and will to break the cycle of sickness and treatment to find real, lasting health. So when you put those 2 ideas together, the whole picture becomes so clear. The dental team's job isn't to just fix you. Their job is to be the mother hen, to peck from the outside with all their skill, support, and encouragement.
And they do this to help you find and unleash your own Henkan Radiku, your own power to change from the inside.
Okay, so that's the philosophy, which is amazing, but what does this actually feel like when you're sitting in the dentist's chair? Well, it all comes down to two really practical things: a sincere investment of time and really deep communication. The very first sign that things are different is the clock. Your initial consultation isn't a quick 10-minute checkup. We're talking 60 to 90 minutes, an entire session that is dedicated to one thing: building the foundation of your partnership. And in that hour or hour and a half, it's all about deep counseling. They want to understand your unique situation, explain exactly where you are now and what risks you might face later, and connect it all to your overall health, like diabetes. It's about answering all of your questions and really driving home the point that you are the one in control of these risks. The whole point is to build a real foundation of sincerity and trust. At the end of the day, this entire system is designed to earn your trust. It's about completely shifting the relationship away from these one-off transactional fixes and toward a long-term partnership that has one single shared goal: your genuine, lasting well-being. And this whole philosophy really leaves us with a huge question, one that goes way beyond the dentist's office. Think about your own health journey for a second. Is it built on an endless cycle of treatments? Or is it built on a true foundation of trust?